Now that assesses the length of the muscles. Now what I want to do is assess the strength of the muscles. So because Scott's already on the table, I'm going to go right into assessing the scapulothoracic muscles. So let's have you flip on your stomach, Scott. Now, what I would like to do from this position is we're going to look first at the rhomboids for Scott. So I'm going to take Scott's arm. He's at, again, 90 degrees of abduction. Elbows at 90 degrees. I'm going to have Scott bring your arm up, and I'm going to ask him to squeeze the shoulder blades together, but I'm going to keep him out here at 90 degrees and 90 degrees of elbow flexion. I stabilize on the opposite side of the scapula, and I'm going to try to push Scott down to the floor. And what I'm looking for, first of all, can he stabilize it? But I'm also looking at, does he get elevation of the shoulder? Go ahead and show that, Scott. So if they pull their shoulder up towards their ear, that's compensation of the upper trapezius. Shows lack of stability through the lower trapezius. That's a primary one. Next one I want to look at is the lower trapezius. I'm going to bring the arm. He's at 90 degrees of abduction, and now I have his elbow flexed up that way. Stabilize the scapula, and I'm going to have Scott resist me. Hold that nice and tight. And what you want to see is the arm should stay parallel to the floor, and it should not go down into that direction. So that's looking at lower trapezius strength. Keep that arm up for me. So you see Scott drop down. That shows a little bit of weakness in the posterior rotator cuff when the arm drops down that way. Okay, very good. Let's have you go ahead and have a seat, Scott. And now what we're going to do is look at the rotator cuff itself. So we'll assess this side. We're going to start in a neutral position. Scott's sitting up nice and tall. And what I want to do is stabilize on the shoulder here. So I'm going to step on this side so we can see it. And what I'm going to do is ask Scott to maintain this position, hold it nice and tight. And again, what I want to make sure is there's no elevation of that upper trapezius. And then I'm going to do the same thing looking at his internal rotation. And I'm looking at two things. Can he keep his elbow by his side, or does he go out into that direction? That just shows he's using his deltoid. So go hold right there, Scott. Good. So you're looking at internal and external rotation. And again, we can look at internal and external rotation from a 90-degree scapular position with the elbow bent. Hold tight, Scott. You look at external rotation, and then you're going to look at internal rotation. The reason it's important to test the rotator cuff up here is that's where a lot of exercises occur. When you're doing pull downs, doing rows, pressing. So it's extremely important to see if the rotator cuff works during those types of activities. Because a lot of times your big muscles like your pectoralis major and minor, your latissimus dorsi, the deltoid, those muscles are nice and strong, but a lot of the smaller rotator cuff or scapular muscles are weak, and that's what leads to some of our movement impairments, as well as obviously some of the overuse. So again, we looked at our assessment. We started with the overhead squat. We looked for, does the arm migrate into that extension position, or do the elbows bend? Then we took Scott over to the door, and before we finished our movements, we looked at an impingement test to see if he had pain. Then we took Scott through a flexion assessment to look at his lat length. Then we took Scott through horizontal abduction to look at his pectoralis major length. Then we went into a rotation test, external rotation to look at pectoralis minor. Then we went into internal rotation to look at posterior capsule as well as his posterior rotator cuff. Then we put him on the table and went through goniometric to look at the isolated muscle length. And then we did some muscle activation and muscle strength tests to look at how well do those muscles contract and are they participating in movement. So that's the assessment portion of the shoulder.